Wonder if you'd benefit from a second opinion about your breast cancer, or any other cancer for that matter? We're going to teach you everything you need to know. When diagnosed with breast cancer, you're naturally going to ask, will I benefit from a second look at my cancer? And are there other treatment options that are available to me? Well, with breast cancer, the treatment decisions are usually straightforward, but I'm going to teach you the advantages and disadvantages of getting a second opinion, and also teach you how to get a quick, comprehensive second opinion in your community. So when do you ask for a second opinion? In the vast majority of situations, you're in great hands with your surgeon, medical oncologist, and radiation oncologist. The outcomes for early stage breast cancer is usually excellent, and you're going to do well with them. But there are a few specific situations which you really should consider or give thought to getting a second opinion. One of those situations is when you have a more advanced cancer. An inflammatory breast cancer is an example of that. It's a more advanced cancer and it's more of a risk to you, and treatment of it is quite complex. Cancer that has already gone to your lymph nodes that you know about before surgery is another example. Or if you have a very unusual type of cancer like a sarcoma or a cancer that your doctor really has not experienced much in their practice. It's also important to consider a second opinion when you're not comfortable with your cancer physician that you're initially working with. You're going to be developing a long-term relationship with your breast surgeon, your medical oncologist, and your radiation oncologist. And so you need to be able to communicate with them and have confidence in them. And then they need to be able to understand you and your needs. And so if you're uncomfortable in that situation, I would consider getting a second look at your breast cancer. What are the advantages of a second opinion? First of all, you can get reassurance in most situations when the second opinion recommends the exact same treatment that you already are planning for with the doctors that you've seen prior to this. That's extremely reassuring when you begin your breast cancer journey. Secondly, you can oftentimes get a second treatment approach, different medications, different imaging studies, different chemotherapies or radiation options that might apply to you and give you options to weigh so you can decide which direction you want to go. What are the disadvantages of getting a second opinion? Well, sometimes a second opinion can significantly delay your treatment, starting your surgery or chemotherapy or delaying your radiation therapy. Let's say you go see your doctor, you have an advanced cancer, you're very concerned, you want to get a second opinion. Then you pick up the phone, you call, you go to another cancer center or cancer physician. It takes you 2 weeks to get an appointment. Then you walk through their suggestions and treatments, and by then, after a month or so, you might want to come back to your original physician and start again. And therefore, what happens, although you're getting that information, you can delay your surgery, you can delay your life-saving chemotherapy. And I'm going to teach you how to shorten that delay so you can do it in sequence by teaching you how to get the best second opinion. There's another disadvantage of a second opinion in that when you do get other options for treating your cancer, and all of these options have advantages and disadvantages, and they're difficult decisions to make, it can take a very confusing situation and make it more confusing. So just be aware that sometimes when you seek a second opinion, there's not just black and white clarity as to the direction that you should pursue with your breast cancer. It's sometimes worth it, but be aware that it might muddy the waters in your decision process. Here is advice on how to best find and obtain a good second opinion. You wouldn't think about it, but the best place to start are the physicians that you're seeing already, such as your surgeon, medical oncologist, or radiation oncologist. You got to think they know who is the very best in your community, in your region, and should know the best options and second opinions even in the country. And it kind of tells you a little bit about them when you engage them. Say, doctor, I'm not sure about the chemotherapy regimen I'm going to go through that you're recommending. I kind of want a second opinion. Who would you suggest? And most of the time, physicians, all they want to do is help you and guide you and want you to be happy with your care. And they will give you the best people in the area. And that knowledge base that they have is really, in some ways, very different and in some ways better than finding things on the internet. If they pull back or show some hesitance or you're concerned that you're offending them, it tells you something about your relationship with them, and it might push you more to get a second opinion. It is also important that either way you find a breast center that is an accredited breast center, a nationally accredited breast center. Look for the terms NAPBC accredited breast center, National Accreditation Program for Breast Centers. That is where you have physicians and nurses and patient navigators working together as a team for patients, and you usually get more sophisticated care. And the way to get entry into a breast center is go on their website, find the patient navigator's name and telephone number and email, and contact that person. They know how to work patients not only into their system, but work with patients through the different complexities of cancer care. So those are the two different approaches that I would suggest to pursue a second opinion. But remember, most of the time you're in great hands with your cancer physicians. To learn more about breast cancer second opinions, visit the Breast Cancer School for Patients, where we will actually teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.